is a hot button topic for many women. We know there are lots of pros and cons and conflicting opinions, but for women of all ages finding it challenging to conceive, we wanted to share some new information that could potentially help women get pregnant faster.
Dr. Yvonne Bohn is an OB/GYN who's also a very busy lady. And we are so happy that you're with us today, especially me, because I'm trying to get pregnant.
Well, I'm so excited to be here and some new information to share. And I'm always excited when something comes out new in women's health, or obviously something will help people with infertility, because it really is a struggle. It's very emotional. It's heartbreaking. So there's some, not new, but the information is being used for more people. So it helps women get pregnant faster.
Well, tell us about it.
So there's something called pre-implantation genetic diagnosis. And so when a couple is doing in vitro fertilization, we take the egg from the mom, the sperm from the dad, they are fertilized, and then they let the embryo grow. And after, depending on which technique is used, either day 3 or day 5 of the embryo, they take one cell from the embryo, and they're able to tell if the embryo carries a specific genetic disease. So previously, it was for couples that, like, say, for example, had cystic fibrosis, or were carriers of a disease, and so they had a 1 in 4 chance of having a baby with the disease. You can make sure that you give the embryo without the disease and implant it into the mother.
Wow.
But what's great is that now they're doing something called pre-implantation genetic screening. And so for women who are older, which is over the age of 35, for couples who've had recurrent pregnancy losses, or for women who have had failed IVF attempts, they believe that it's because the embryos are genetically abnormal. And now they can screen the embryos before they put them in. And that way you have a less likely chance of losing the pregnancy. So it increases the success rate of IVF from approximately 40% to about 80%.
So is this suitable for all women, or?
No, it really isn't for all women. Like I said, they should have one of those specific high-risk categories. Because
which are they again? Can you
okay, so one is if you know that there's a genetic disorder that you're a carrier of, if you've had multiple miscarriages, if you've had failed in vitro attempts, those would be the main reasons for doing it. Because when we biopsy the embryo, we can hurt the embryo in the process. So you don't want to do it if you don't necessarily have to do it. And also it is rather expensive. It does add anywhere from $4,000 to $9,000 to the cost of a cycle of IVF.
Wow. Well, aside from
Wow,
this,
that's like a $45,000.
It gets.
I better start saving. No, just kidding.
It gets quite pricey.
Well, aside from this particular screening, what else is out there to help women with fertility issues?
Well, I think it's really important, especially for someone like you who now is recently married and ready to move to that next, part of her life, is to really assess where you are in your fertility. So unfortunately for women, it is real. We do start to lose our fertility as early as age 35. Okay, so let's say you're 33 and I'm going to wait a few years. You want to make sure that you really do have those few years to wait, or if you're 40, do you really need to get on it so that you have a chance to have a baby? So there's 3 simple things that just a regular OB/GYN can do to check your fertility. There's a blood test that we do on the 3rd day of the menstrual cycle called the day 3 FSH and estradiol. And those numbers can give me a guideline into, do you have time? Are you borderline? Or have you already missed your opportunity? We use that in conjunction with a test called the anti-Müllerian hormone. That's a blood test that can be drawn any day of the week, any time in your cycle. Again, it tells us how likely are you to respond to IVF if I had to stimulate your ovaries. And then the last thing you can do is something that's done with an ultrasound. It's called an antral follicle count. That's where we actually look at your ovaries and count how many eggs you have left. And
so now this is good for everybody just starting to try to have kids? Or?
I think it depends. Like if you're 24, probably not going to have an issue with ovarian reserve.
I was 36. I was 36 when I got pregnant for the first time, so that's probably
so we're talking about women, probably the women who are between 30 and 35, and they're trying to make a decision like, can we go spend 5 years and go vacationing and wait to have babies? Should I consider freezing my eggs? So it really is to be just in control of your fertility and know like there is a time limit.
Yeah.
And it's very simple, like you don't have to go to an in vitro specialist to do this or an IVF specialist. You can do it with your gynecologist.
Dr. Yvonne Bohn, this is great information. Thank you so much.
Welcome.
Yes, it's so nice to have you. So you can learn more about Dr. Bohn at laobgys.com, and we're going to be right back. And you're going to see me soon, and my vagina.